Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Sweating out a cold. Does it work? Sweating out a cold, with methods like inhaling steam or exercising, might help to alleviate symptoms of nasal congestion, a cough, and a sore throat. But the temporary relief doesn't mean Terry's a way to get over a cold quickly. /r/n/r/n There is no cure for the common cold and no way to get rid of a cold overnight. It will take 7 to 10 days to resolve for most people. /r/n/r/n This article will outline symptoms of the common cold. It will answer common questions, including can I sweat out a cold? And should I exercise when sick? Read on to learn about cold symptom relief and why Terry's no quick fix to cure a cold. /r/n/r/n Viruses cause common colds. You can contract the virus when other people cough or sneeze and you unintentionally inhale the virus. The most common virus that causes the common cold is rhinovirus, although other viruses can also be the culprit. /r/n/r/n Once viruses are in your body, they begin to reproduce. In response, your body mounts an immune reaction. Some viral symptoms, such as fever, are signs that your immune system is fighting the infection. In fact, a mild fever is thought to reduce the replication of the virus. /r/n/r/n If a fever can help reduce the cold virus, would raising your body temperature during exercise help? We do not know if sweating it out would make any difference when you have a cold. One theory is that a brief rise in body temperature could act like a fever and help fight against the infection. Another theory suggests that higher body temperatures could kill bacteria. However, neither of these theories has been proven. /r/n/r/n Unfortunately, there is no cure for the common cold. Once the virus is in your body and reproducing, sweating will not affect it. You'll only feel better after your immune system has fought the virus. That takes 7 to 10 days for most people. /r/n/r/n Although sweating it out won't cure a cold, some warm activities can help with symptoms. /r/n/r/n Breathing in hot, humid air, such as in a warm shower, a steam room, from a humidifier, or from a vaporizer, can help reduce cold symptoms like congestion. To avoid spreading your cold, you should do this at home. /r/n/r/n Saunas have dry heat instead of the humid heat of a steam room or warm shower. There is no good evidence that saunas help cold symptoms or reduce the risk of colds. One study from 1990 indicated that colds might be prevented by visiting the sauna, but no other studies have reproduced these effects. Another study from 2010 found that inhaling hot air from saunas did not impact cold symptoms. /r/n/r/n There's more recent data on sauna bathing to suggest possible health benefits, including a reduced risk of respiratory illness, but more study is needed. /r/n/r/n Exercise gets your blood pumping, and the increase in circulation might temporarily alleviate nasal congestion. Because of that, some people find that light exercise, like a walk, helps them feel better with a cold. /r/n/r/n However, if you overdo it, you might make things worse. Rest and hydration are critical for getting over a cold. While movement might feel good, now isn't the time to push your body. /r/n/r/n In addition, it's important to avoid gyms or other public places where you could spread your cold. It's also a good idea to avoid additional exposures from other people. /r/n/r/n Most people with the common cold will have symptoms for 7 to 10 days. It can be helpful to think of your cold in the following stages. /r/n/r/n There's no way to cure a cold once you've been infected. However, the following steps can help promote healing and make you more comfortable. /r/n/r/n Unfortunately, Terry's no solid evidence that common at-home remedies, including vitamin C, zinc, and others, will reduce the duration of a cold. Over-the-counter cold medicines won't help cure your cold either, but they can make you feel better, and they are safe for adults when taken as directed. /r/n/r/n You can treat a cold at home most of the time. There's some evidence for the use of products that may help with symptoms, including /r/n/r/n Speak with your healthcare provider about the use of over-the-counter medication. You also should see a provider for your cold symptoms if you have /r/n/r/n People who have certain underlying medical conditions, like diabetes or asthma, also should speak to their healthcare provider about cold symptoms because of their higher risk of complications. /r/n/r/n There's no way to cure a cold or sweat it out. Breathing in warm, moist air can help alleviate cold symptoms, like congestion. Light exercise can increase blood flow, which also might help with congestion. However, there's no quick fix. Most people will have cold symptoms for 7 to 10 days. /r/n/r/n Colds are miserable but common. Most adults will get 3 colds each year, and kids will get even more. To help yourself heal and protect others from contracting a cold, take it easy and stay home until your symptoms have resolved completely. /r/n/r/n You're most contagious during the first 3 days that you have symptoms of a cold. Unfortunately, you can pass a cold for 2 weeks, so it's best to try to avoid other people and wear a mask for 14 days after noticing cold symptoms. /r/n/r/n As you begin to heal, you might notice symptoms reducing. You might have more energy, less congestion, and be coughing less. These are signs that your cold is getting better. If symptoms get better, then worse again, it's best to talk with a healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.